Okay, I'm just going to review just very basic exercises for the major muscle groups, the kind of common exercises that you would do in a clinic and that we talked about in the lab, and just kind of point out some of the anti-gravity and gravity eliminated positions and just make a mention of what kind of contractions are going on. So for hip flexors, you can do sitting hip flexion like this, which would be considered anti-gravity. And remember, we pointed out in the lecture that that is actually kind of a shortened position for the hip flexors and maybe not be the best position to do that activity in. So commonly hip flexion, you're going to do lying down, and you can do either what's called a heel slide, and again this is just hip flexion. You could do knee to chest, which is really the same motion as a heel slide, but it's going to be harder because it involves lifting up more of the leg. There's also a straight leg raise. So note that a straight leg raise is really a multi-joint activity because you're flexing at the hip and you're extending at the knee. Okay? It's an isometric contraction of the knee extensors, right? Here. And if you have somebody who's kind of doing this kind of thing, they're not able to stabilize over that knee, it may be too hard of an exercise for them. And this would be considered an anti-gravity activity, right? Because it's against gravity. So the difference between the two, this is actually going to be hip flexion and knee extension, using primarily rectus femoris, and this is really just a hip flexion activity. Okay? Common way to stretch the hip flexors that we talked about is just to go prone, like that. That's one easy way. We also talked about having it off the side of the mat, just like that. Remember, if it's off the side of the mat, you want to watch that the pelvis is kind of rooted on the opposite side, so you're not going too far into anterior tilt. Okay? And I'll demonstrate gravity eliminated hip flexion later. So hip extension, you can do gravity eliminated as a bridge, just up like this, and that's pretty much all gluteus maximus activity. But the typical anti-gravity position for both hip extension and knee flexion would be prone. Right? So hip extension is going to be this, hip flexion is going to be, or knee flexion is going to be this, and that's against gravity. So notice that this is really more of a gluteus maximus activity because it's just using the hip, whereas this is going to be hamstrings. And you can do both. That's kind of a harder activity for most people. Okay? And then we talked about to stretch the hamstrings, right? We talked about a common activity is to kind of be in long sitting. And what we emphasize is that what you want to make sure the person is doing is not that they're hunching over their toes, because you can do this just by flexing your spine and not by moving your pelvis. You want to make sure that their pelvis is rotated forward, okay? Because the hamstrings are attached into the ischial tuberosity, and you want to move that insertion spot away from the muscle, okay? So a good hamstring stretch is going to utilize that pelvis coming forward, all right? So even in this position, even though I'm not bent very far, I can really feel my hamstrings because I'm pushing my pelvis forward that way. And I'll show gravity eliminated hip extension when I show the hip flexion. For abductors, okay, so against gravity, it's just going to be going straight up in a sideline position. Remember, you want to make sure the person is right on their side, okay? If they're coming kind of forward like this, they might be using some hip flexors, so you want to make sure they're back in a straight line, like that, okay? For anti-gravity adductors, right, you would want to do the bottom leg, okay, which is a little bit harder to do, but that would be anti-gravity adduction. So you'll note, for example, when you're doing this activity, okay, when you're in an anti-gravity position, when you come up, right, this is going to be concentric, going against gravity. Coming down is going to be eccentric because you're going with gravity. You're still using your hip abductors. So coming up or coming down, it's still abductor, just going in a different way. In the same way, for hip extensors in the anti-gravity position, when you're coming up, that's concentric. When you're coming down, it's eccentric. But it's still hip extensors. And then back for the hip flexors, okay, for straight leg raise, coming up, that's your rectus femoris, and coming down, it's the rectus femoris. Okay, just in one place is concentric and the other way is eccentric. And another way you could do adductors for anti-gravity is coming out and in. This case, coming out would be the eccentric, and then coming in would be the concentric, right? Gravity eliminated for hip adductors, okay? Just lying supine on the mat, bringing the legs out and bringing the legs in, okay? So note in the gravity eliminated position, and you can feel this on yourself, when you bring the leg out, that's hip abduction. And when you bring the leg in, that's hip adduction. And you can feel that your abductors are pulling the leg in, that your adductors are pulling it out, I should say, and your adductors are pulling the leg in, right? So when it's a gravity eliminated position, it's actually going to be concentric in both directions versus the anti-gravity position. For external rotators, a common exercise, anti-gravity, having your hips and knees bent, and then bringing the knee up and out like so. And again, both directions are going to be, you're still using your external rotators in both directions, but in one case it's going to be concentric, in the other case it's going to be eccentric. And those are some of the muscles and the muscle groups.